Welcome to another episode of What the Gut. I'm your host, Melody Noreen Blackwell, health advocate and founder of Color of Crohn's and Chronic Illness. As many of you know, March was Colorectal Cancer Awareness Month. With April being Minority Health Month and due to the importance of awareness about colorectal cancer in our community, we are highlighting it today. Why is it so important? Colorectal cancer is the third most common cancer that's diagnosed in both men and women in the United States. Black Americans are 20% more likely to develop the disease, yet 40% more likely to die from this beatable, preventable, and treatable disease. In just a moment, we are going to check in with some folks from our community to find out what they truly know about colorectal cancer. And right after that, we'll be speaking with Dr. Fola May, a gastroenterologist and health equity advocate, followed by some tips from yours truly and therapist Dominic Battle. Now, let's get to the community and hear what they have to say.
I'm here in the community to bring awareness to colorectal cancer. What better place to be than your local barbershop? Sitting here with one of the great barbers in this barbershop. And AD, I just wanted to ask you a few questions. First of all, how old are you?
I am 42 years old.
How old are you? 41. 41, okay. 48 years old. 55 years old. How old are you?
56. Be 57 in 2 weeks.
Oh man. Happy early birthday.
Appreciate that. Thank you.
I'm 58.
58. Has anyone in your family ever had colorectal cancer?
I do have an uncle that survived from colorectal cancer.
Has anyone in your family ever been diagnosed with colorectal cancer?
No.
No. Any family members that have been diagnosed with cancer?
Not colorectal cancer. Right. I lost my father with prostate. Pancreatic cancer.
Has anyone in your family ever had colorectal cancer?
My in-law, she has it.
Okay.
She's in the 4th stage of colorectal cancer right now.
And she's being treated for it?
Just recently, she just started her radiation for it, and it's right on the outside. It's like a sore that won't heal.
Has anyone in your family ever been diagnosed with colorectal cancer?
Not at all.
Not at all. Do you know what colorectal cancer is?
I have a basic understanding, but I don't know.
Do you know what colorectal cancer is?
Kind of.
So do you know what colorectal cancer is?
No.
Do you know what colorectal cancer is?
Yes.
Colorectal cancer is when abnormal cells in your colon, they start to grow out of control, basically, and polyps are developed. And then once polyps are developed, that's when, the doctor, they can test to see if it's benign or malignant, and that's how colorectal cancer is developed.
We as guys, we're fearful of the whole finger thing. We play a lot of jokes and talk about the finger thing.
And since you've been screened before, you do know the process of how it takes place, how they do the screening.
Yeah, well, I had you said colorectal?
Yeah.
Okay, well, I had the finger, so I don't know if that's the same thing.
Oh, no, that's not the same thing. That's
what I had.
Yeah, that's totally different. Okay. You did mention that you're going to get screened. Do you know what the screening consists of?
The stool, and the colonoscopy.
So you get scheduled for colonoscopy.
Yeah.
Okay, perfect.
And as for testing, there is no finger involved.
Because my doctor has fingers like Matumbo.
Yeah, I think because, I know we're joking and everything, I think because you heard me mention prostate, there's a finger involved there.
Because it's a lot of myth that goes around about how you can be tested for, how you get screened for. Now they have a procedure, a screening now where you can do an at-home test. Basically, a stool sample is non-invasive, and you can send it out, and they can give you results over the phone, and they let you know if you need to see a specialist or not. Would you be willing to, if we can provide you with the testing?
Of course.
Okay, perfect.
But with colorectal cancer, you can actually do a stool sample at home. And you can send it in and be tested, and you can go from there.
Oh, yeah, interesting.
Yeah.
I didn't know.
Yeah, technology
I had
has
no idea.
changed. Yeah.
I had no idea. I would be willing to do something like that. That's less intrusive.
Are you willing to talk to your family members and spread the awareness of colorectal cancer in our community? Are you willing to go back home and talk to your family and friends about bringing awareness to colorectal cancer?
Oh yeah,
That's awesome. That's awesome.
Well, you know, because I'm getting on the age, so I've been made aware it's about that time. The people I've been around, spend time with my age group, some of them have gone through the process. They've done a good job. You know, we stay in that communication. But I think it's good now. Before this day and time, I think it's old. Like, you know, I never heard older people advise younger people as we get age, hey, go get checked, worry about that. You know, so I hopefully we're in a different time where education is being shared, you know, amongst our own a lot more frequently and better, and more broadcast. Social media, everything else comes to a lot.
Yeah. So it sounds to me like you have no issue with bringing awareness to your community, to your customers, to your family. Would you be willing to go home and, you know, talk to your family members and friends and community? Thank you. Appreciate it.
I would be willing to tell my clients more about it.
Awesome.
Yeah.
That's awesome.
That's cool.
Yeah, I plan on being around for a while, so you know, I want to do everything it takes to be here. I want to stay in the game.
Yeah.
I got a lot of stuff I want to do.
Exactly.
Right.
If it's gonna save my life, yeah, man, I'm trying to at least get to 80, 85.
Hear that, bro?
Yeah, I got grandbabies.
Every year we shed light on colorectal cancer in the month of March. With April being Minority Health Month, I wanted to keep the conversation going, especially for the Black community. Why do we bring awareness to this disease? For many reasons, but one of the most important reasons is that colorectal cancer is preventable, beatable, and it's treatable. Did you know that Black Americans are 20% more likely to develop colorectal cancer, but 40% more likely to die from this beatable disease? Let's talk about why. Here today, we have the amazing Dr. Fola May, a gastroenterologist and health equity researcher who has been wearing the cape of colorectal cancer, educator and advocate for the Black community, using her voice and expertise to provide tips on preventative care. She is passionate about improving awareness about preventative health and health equity. She's involved in advocacy at the state and national level to develop and encourage policymakers to improve healthcare, especially around colorectal cancer care. Welcome, Dr. May. We are so happy to have you.
Thank you so much for having me. I'm excited to be here today.
So Dr. May, can you tell us what the difference is between colon cancer, rectal cancer, colorectal cancer? I know I personally keep hearing these words interchangeably, and I'm like, which way are we going? Which way does it go? Like, what is it?
Absolutely. That's an excellent question because we use those terms interchangeably, and I think it's important for people to understand what we mean. So colorectal cancer refers to cancer that occurs in the colon or in the rectum. The colon is a 6-foot-long organ that is at the terminal end or the last part of your digestive system. It's really just there to absorb water, to absorb a little bit of salt, normal amounts of water and salt that our bodies need to function normally, and to create stool, to eliminate stool from our body. And the rectum is the very end of the colon. It's about 6 inches long, and its purpose really is to be a reservoir for stool until we're ready to pass the stool into the toilet bowl. So it's actually good that we have a rectum because it allows us that control. So we refer to colorectal cancer as cancer that occurs in the colon or rectal. And the reality is that most patients are able to define whether their cancer is in the colon part or in the rectum part. But because these cancers are similar in how they occur, we refer to both of them collectively as colorectal cancer.
So that's why they're like connected, but they're segmented.
Yeah, they're just two segments of the bowel tract, the very end. And, really what happens is that polyps turn into cancers. So that happens either in the colon or in the rectum. So we've lumped them together into a disease state that we collectively call colorectal cancer.
Now that makes sense. Okay, so we got it. Lower end, it's in the long intestines at the bottom. Got it. Can you tell me how someone gets colorectal cancer?
Yeah, I mean, I think a lot of people don't realize how common colorectal cancer is. And I love that we're going to be talking about health equity today. Colorectal cancer does disproportionately impact Black Americans. But a lot of people are shocked when they hear people like me say that colorectal cancer is the #3 cancer in men and it's the #3 cancer in women. So for men, it follows just lung and prostate. And for women, it follows just lung and breast cancer. It's very common. And when we look at deaths from cancer, it actually rises to the #2 cause of death.
Wow.
So just after lung cancer, when we look at all causes of death in men and women in the United States. So it's very common. Unfortunately, it's killing way too many people. And the way that we get colorectal cancer is the progression of colon or rectal polyps to cancers. So polyps are these small outgrowths. They look like small pimples that develop in the colon and rectum over time. Most of us will develop polyps. We say that upwards of 30 to 40% of the population will develop polyps in their lifetime, usually when they're older. And unfortunately, a small percentage of these polyps have the ability to transform over time into cancer. So they grow uncontrollably. They develop dysplastic or abnormal cells. And those cells go on to grow uncontrolled until they can actually cause blockages in the colon, bleeding in the colon or rectum, and these other symptoms that we now know are common presenting symptoms for colorectal cancer.
Wow. So you mean to tell me that these little tiny bumps that we can't see with our naked eye, we can't feel them either because they're in our colon. They create a lot of havoc and chaos if we don't get it checked out, because I hear all the time doctors are saying and advocates are saying that this disease is preventable, beatable, and treatable.
Yes.
So
Absolutely.
why is the Black community at risk?
Yeah, no, and I love what you just said, because this does all start at the polyp, and we can't feel polyps. We don't even know when we develop them. So that's why screening is so important. And I think we're going to talk about that a little bit later, because with screening, we can find polyps, we can find early cancers, and we can prevent deaths from colorectal cancers. This is especially important in the Black community. As we mentioned, Black Americans are 20% more likely to get colorectal cancer, 40% more likely to die from the disease. It's a disease that we say disproportionately impacts Black Americans. We have a lot of work to do. Why is this happening? We think it's multifactorial. We can't really point to one reason why Black Americans are disproportionately impacted by colorectal cancer, but we do think that it's a combination of historical events, social policies, lack of health insurance, lack of information about the importance of screening. There's also a problem with access to healthcare providers in the Black community. And it's the combination of all of these things, including less participation in screening and treatment, that have collectively led to poorer outcomes in Black Americans.
So tell me, if you're like, we have these barriers to entry, barriers to education, barriers. What should we be doing, I guess, as advocates or family members to help bring awareness and to change this narrative?
We certainly need to talk about this disease more. My concern in the Black community is that there's such a stigma in talking about diseases that impact intimate areas of the body.
Right.
No one wants to talk about their stool changing, abdominal pain, blood from their rectum, blood in the toilet bowl. No one wants to talk about a colonoscopy, which we think of as an invasive procedure that involves instrumentation of the rectum.
Right.
This affects everybody, but especially in the Black community, there is such a stigma about talking about these problems with each other, with family members, and especially with health providers. And I think, unfortunately, that has led to lack of participation in screening, people who are very hesitant about colonoscopy. And unfortunately, what we see a lot, and what I see a lot in my patients, is people waiting too long on symptoms. I mean, it's very often that I unfortunately am caring for a Black individual who I've recently diagnosed with colorectal cancer. And when I sit down and talk to that person, they report, you know what, doc, I've been having blood in my stool for months, or I've been having this new abdominal pain and a change in the shape of my stool for about a year. And I just didn't talk to anyone about it. So I think those are the things that are unfortunately crippling the Black community.
Yes.
And we need to get over that. We need to talk about this disease to each other, with our family members. We need to be educated at an early age. I would say even starting at 20 and 30, talking about when you are 45, you need to start screening. And we need to be better at passing along family history.
Right.
When colorectal cancer is diagnosed in the family, you need to tell family members, because those family members potentially will need to be screened earlier.
Right. Right. So, you said something that I thought like hit the nail on the head. I have Crohn's disease, I have IBD, and it took me 4 months of bleeding, of dealing with feeling like knives were slicing my colon, abscesses popping. It took months for me to finally say, I should probably just go ahead and head to a physician to figure out what's going on. And I couldn't eat. Changes in stool, all of those presentations that are kind of similar to the presentations of colorectal cancer. I dealt with that, but I shelved it because a lot of people in our community, they don't want to risk losing their job. They don't want to risk losing their income or like just to take the day off. So there's other social determinants of health that really stop us. They put us at a stop sign or a halt because of fear of what will happen after. Because what if it is something that's really tough to deal with? Like for me, I was out for months dealing with my health, and that could stop someone who is in a lower socioeconomic level from wanting to say, let me invest in my wellness, all the while they're slowly adding to their death.
Absolutely. I agree with you completely. And I'm happy that you're sharing your story, because I think that it's just too common that this is happening to people in general, but especially Black individuals. And when we talk about colorectal cancer, when we talk about health disparities, yes, we talk about social determinants of health. We talk about competing demands.
Yes.
The reality that there is so much going on in a life. There are jobs to keep. There are people, small children, elderly to take care of.
Yes.
That get in the way of prioritizing our health. But there's also the problem of structural racism in the healthcare system.
Yes.
And unfortunately, Black patients experience this more than white patients. We've all had the experience, and even me as a medical provider have had the experience where we've sought care and we felt that our complaints were being ignored. We felt that our symptoms were being downplayed.
Yes.
What does that do? It only promotes us not seeking help when something comes up again in the future.
Absolutely.
So it is exactly as you said, it's this interplay between social determinants of health, the competing factors of life that we're dealing with, and these stressors that often are more in the Black community.
Yes.
And then also this grave hesitancy that is based on this historic structural racism that we have in the healthcare system.
So knowing that there's certain foods that are really attached to our community too. So we're talking about, how challenging it is to get to a provider, so access, and then the neighborhoods and our family and quality of life. But that also brings me to our food. Like we eat a certain diet, very savory. And with Crohn's, I had to restructure a lot of things. And although I didn't eat a lot of our savory foods because I could feel that my body wasn't responding well to it, I still know that there's things that I love, like bacon. And I know that that's not necessarily the best for my diet, but I have to have something. Does diet play into colorectal cancer at all?
Absolutely. We think that diet and lifestyle are actually about 50% or more of the risk. I know, it's so hard to hear, but it's good news, right? Because that means that there are things that we can modify about how we're living our lives that can reduce our risk for colorectal cancer. And I'd like to share some of those things because I think they're important.
Absolutely.
We talk about diet. And you mentioned bacon. And the first thing I tell my patients is that they need to reduce or eliminate their intake of processed meats. And bacon,
that would be bacon.
Bacon is one of those processed meats, sausage, hot dogs, anything that comes out of a can, anything that's cured, my charcuterie plates that I'm obsessed with, those are all processed meats. And in most cases, unless there's special preparation, those are processed meats. So you need to try to actually eliminate or nearly eliminate processed meats. The other type of meat that we talk about is red meat. So this is beef, steak, pork. These things you can have in moderation.
Okay.
So I'm not trying to tell everyone to become plant-based. I think
Right,
especially in the
right.
Black community, that's just not a lifestyle that we traditionally embrace.
Right.
But we need to move towards a lifestyle where we're limiting the amount of this that we're taking into our bodies.
Okay.
The other thing we can do is we can increase fiber. High fiber diets we know are associated with lower risk of colorectal cancer. So that's green leafy vegetables, wheat, oatmeal, things like that can be very good for your diet. And you can get that naturally in foods, but there's also supplements that you can take
Right.
for fiber. And then we also want people to make sure they're getting generous amounts of calcium and vitamin D, because those are related to colorectal cancer risk as well. Other lifestyle things that have been popped up in studies, you want to eliminate tobacco, and you want to reduce the amount of alcohol. So for women, that is 1 alcoholic beverage or less per day. For men, it's 2 alcoholic beverages or less per day on average.
Can
So
you like
that's gonna
save
be
all
part
of your days and like have them all?
I know, right? And you know what, people do that. I'm going to be honest. I talk to a lot of patients about diet and exercise and wellness, because these are things that are not only important for colorectal cancer prevention, but all cancers,
Right.
diabetes, heart disease. Everyone needs to get a moderate amount of physical activity, which is 100 minutes of vigorous activity a week. And, you know, I do tell patients that if they want to eliminate alcohol during the week and save it for the weekend, that's fine. Binged alcohol drinking is never recommended,
Right.
but you certainly can have more than
You
one
can have
drink a day.
2. You can
Yes, as long as you don't do it every day.
Right, absolutely. So those are great tips. And another thing I want to ask is, you brought up previously about familial history. So we have the diet, so we can go in and we can start easing our way to talk to our family about their diet. But how do we like suggest a colonoscopy? Where does that conversation come? Is that the only way that we can suggest screening for our families, as we're now saying, hey, I'm coming in, I'm going to be the health advocate for the family, you get a colonoscopy, I mean, I don't think that our family is going to respond to that. So like, what else could we do to like break the ice on this conversation, but also suggest something where, we say, look, I know that this is scary. I know that it's something that we don't really want to think about, but we're already predisposed. We're already naturally at risk because of our ethnicity. Here's something that we can do as a family. We can all get tested. Like, is there something that we can introduce with that process that's less invasive or formal than a colonoscopy?
Yeah, I mean, I think you're hitting on a lot of the really critical points. These discussions are going to be uncomfortable, but we need to get over that discomfort.
Right.
Because regardless of how uncomfortable the conversation is, it's much more uncomfortable when there's a cancer diagnosis in the family.
Yes.
So there are a few conditions that we need to take seriously. You mentioned a history of inflammatory bowel disease, a Crohn's disease. Individuals that have Crohn's disease, we screen earlier for colorectal cancer.
Okay.
Individuals with a family history, we screen earlier. So if you have a mother, brother, sister, father that has had colorectal cancer or advanced adenomas, which is the type of polyp that we're most concerned with, then we would recommend that you start screening at age 40 or earlier.
Okay.
So for those people, it's especially important to have these conversations in the family.
Right.
But even beyond that, as you're mentioning, even when there's not a family history, it can be very helpful to bring these things up. And I know it sounds kind of crazy, but I do suggest bringing it up at the dinner table. I do suggest lumping it in with conversations about all health. Everyone should be having an annual exam with their primary care provider. And that provider will go through whether you are at the time where you need to be screening for colorectal cancer, diabetes, heart disease, other types of cancers. So it's important that you attend those appointments. And that's a perfect time to come home and talk to other family members. I was at my primary care provider today, and these are the things that are recommended that I get done in the next year. We have to make these conversations more comfortable. We have to empower patients with the information so that they feel comfortable talking to their families. We use people, with the partnership that we have with Cottonelle and Black Health. We've used comedians and actors like Dion Cole to bring a little comedy to the table, which can be helpful in some situations as well. But it's an uncomfortable conversation that we have to find a way to infuse at the dinner table.
You just mentioned a lot, and there's something to preventative care that I think we don't respect or acknowledge enough, because those preventative care appointments, they lead to the next phase of what could possibly be brewing or stemming in our bodies that we have no idea about. I think that's where the line of disconnect happens, because there's a lot of people that don't do their yearly maintenance. They 2 years, 3 years, who have health insurance. So how do we even start to introduce that? That may be the first step, is saying, have you been to your preventative yearly exam?
Exactly. I think so. And especially this year, right? With COVID,
Yes.
people have gotten so behind with their health. People are nervous about coming into health centers, nervous to see their doctors. The reassuring thing is that most health systems have a lot of security or safety policies in place. We have made it optimal for patients to come in when they need care. And we've also introduced virtual care. So a lot of times you can see your primary care provider, like we're talking today, over the internet or over Zoom. So there are many ways to get this done, and we need to encourage this. In the Black community, we do not seek preventive health. We wait until there's a problem, and then we seek attention, and it's often too late. I like to remind people with colorectal cancer in particular, if I am able to diagnose your colorectal cancer during a colonoscopy and you are stage 1, you have a 90% survival, 90%, okay?
Wow.
But if we wait a long time and you present later and you come in with stage 4 disease, your survival drops to 11 to 15%.
Wow.
That's a huge drop.
Wow.
And that equates to waiting a year or so with symptoms and not seeking attention, or not getting screened in the first place. So you asked earlier, and I realized I didn't answer. I mean, you can get screened with a colonoscopy, but there's also ways that we can screen you at home. There's the FIT kit, which is the fecal immunochemical test.
Okay.
This is a test that comes in a box that you can perform at home in the comfort of your own home. It gives you instructions on how to collect a small stool sample, put it into a sealed container, send it into a laboratory, or it can give you a result right there in your home. And it tells you if there are small amounts of blood in the stool.
That's
if there are,
advanced.
yeah, it's great, because especially now during COVID, a lot of people are
Right.
hesitant about coming in. So we can give you these kits, we can send them to your house. Cottonelle and Black Health has been sending these to members
That's
of the
awesome.
Black community,
That's
especially in March for colorectal cancer awareness. And it can tell you whether you have blood in your stool. If you have blood in your stool, it may be a sign of colorectal cancer, and you need to have a colonoscopy. So we've really moved this concept of everyone needing a colonoscopy to the 5 to 8% of people who have a positive FIT result that we really need to focus on bringing in for the colonoscopy. And that's a way that we've been able to get a lot more people participate in screening.
Now, do you know where people can actually find these kits? Because I think that if you're having these conversations, and maybe this is like a Father's Day gift, Mother's Day gift, a Christmas gift, like this could be something where we start to say, look, I'm going to invest something that's going to prolong your life. This is where I'm going to put my money in, instead of the sweater that you're not going to wear in 6 months, or the shirt or the shoes or something that's going to be out of season. We can invest in making sure that the quality of life is managed by these preventative health tactics.
Absolutely. And these kits are widely available. I've been really excited to be part of this partnership with Cottonelle and Black Health, because what we've done is we've worked with groups like Colorectal Cancer Alliance to make sure that individuals are aware that these kits exist, and also make these kits available to individuals who are due for screening. So I have been encouraging people to go to cottonelle.com good down there. So cottonelle.com/good down there to learn more about colorectal cancer, to learn about screening, and to learn specifically about the fecal immunochemical test, or the FIT test. And Cottonelle has also been providing these kits to Black individuals who are in need of screening. When that's not available, you also can talk to your primary care provider. They can either mail or hand you one of these kits that you can perform at home.
That's phenomenal. You know, speaking of Cottonelle, I've been following what they've been doing with the Good Down There care. I also noticed that in conjunction with Black Health and Colorectal Cancer Alliance, they're actually providing people with the opportunity to get colonoscopies who may not be able to afford them or have access to the healthcare that will allow them to have a colonoscopy.
Absolutely. Again, this has been an incredible partnership. And Black Health has been trying to empower the Black community about health problems that disproportionately impact us. They've started with colorectal cancer with the support of Cottonelle. And the Down There Care campaign is specifically about getting information, resources, and screening more available for the Black community. They also, as I've mentioned, partnered with a Colorectal Cancer Alliance. Colorectal Cancer Alliance is an advocacy organization, and they are providing information for patients, also resources to help connect patients to providers when colonoscopies are needed, and financial resources to get the colonoscopies done in the cases when the FIT kit or that stool-based screening test is positive. So it's an incredible collaboration. I'd love to see more work like this. I'm hearing that those kits flew out the door really quickly.
Yes, that's phenomenal, because that means that people are doing what we want them to do. And you mentioned COVID. I know that that's probably caused the numbers of screening to decrease drastically, let alone in the Black community. So this partnership, this opportunity for equity and to decrease the disparity that's going on, it's phenomenal. And I am like, I may not have got a kid, but I'm tremendously grateful for what Cottonelle and CRC and Black Health, they've done to make this accessible.
Absolutely. And like you said, especially now during COVID, but I think also finding a unique way to appeal to the Black community, because there is a lot of messaging around there that about colorectal cancer, but there isn't that much messaging that this disproportionately impacts Black folks.
Absolutely.
So you know what Cottonelle's done is brought that to light, and they've used, as I mentioned, Dion Cole and their website and other resources to really hone into that specific targeted and tailored information that the Black community needs to hear.
Absolutely.
To activate themselves against this disease.
Absolutely. Well, Dr. May, thank you so much for your time. We are going to post some tips that you've provided with us, and we're going to make sure that we continue to push the message that we need to get screened, because colorectal cancer is preventable, beatable, and treatable. Thank you so much. And this has been What the Gut.
Thank you for having me.
Wasn't that great information? We would like to thank our participants for their willingness to engage in this conversation, and Dr. May for providing so much insight. Both provided information and opportunities for us to make an impact towards changing the narrative surrounding colorectal cancer. Let's take a moment to recap some really important points. Number 1, African Americans are 20% more likely to develop colorectal cancer, but 40% more likely to die from it. 2, colorectal cancer is a treatable, beatable, and preventable disease. 3, there are options for getting screened for colorectal cancer that are non-invasive, including a do-it-yourself at-home testing kit. 4, should you have a colonoscopy, you should know that you're sleeping during the entire process and it does not cause discomfort. In fact, you wake up with an opportunity to improve your health. 5, diet does play a role in colorectal cancer. We want to eat more leafy greens, colorful fruits and veggies, foods with fiber, and calcium-rich foods. We want to limit processed meats, red meats, and alcohol. Lastly, we want to take the time to have these discussions with our loved ones. We have to encourage each other to stay on top of preventative health care. Early detection is key in managing and beating any disease, and preventative care is the first step in determining whether or not our bodies need further investigation. You're worth the effort that it takes to get the health care you need, and so is your family. Joining us now is therapist Dominique Battle. We've been having this conversation about colorectal cancer and highlighting that there's a disparity in our Black community. While we're 20% more likely to be diagnosed with colorectal cancer, we're actually 40% more likely to die from this beatable, preventable, and treatable disease. During this conversation with Dominique, we want to talk about why that is, why there's such a huge gap. If we're 20% more likely, why are we dying at this rate? And what can we do to change the narrative on that? Dominique, thank you for joining us.
Thank you so much for having me, Melody. I appreciate it.
So as you and I have talked about this, why this is occurring, not talking about health within our families, what do you think some of the reasons are why we're dealing with this at such higher rates?
I think that when it comes to visiting our doctors and being able to go to our doctors in the Black community, I think that we have certain preconceived notions about, what it means to speak to our doctor.
Absolutely.
Confidence in our doctor, feeling like we can truly say what we need to say, one, and then also feeling like we're not being heard when we do.
Absolutely. Absolutely. And we talk about that a lot as Black patients go to these providers. I recall an incident someone shared where she actually asked the provider, have you ever worked with Black patients before? And the provider just started crying and said, I've never had anyone ask me that. And that was really interesting and challenging, because you should be able to ask your provider questions like this to build a relationship of trust and transparency, right?
Right. You would think, but oftentimes they are either not prepared to answer that question, or some people have even gotten offended. Some doctors have gotten offended when that question was asked, as if there was any kind of, I guess, stereotypical things behind it. But it's truly just knowing, I need to know that you understand my cultural issues as well as my medical issues.
Right. Cultural and linguistic awareness is really important, especially when you're treating minority patients. And when I read about that situation, I just was like, this is not a fair way, because now the doctor is is exposing this patient to trauma in another avenue. And that's not what we go to our healthcare providers for. And it's, we've discussed these implications of structural racism and racism in healthcare. So changing the narrative and getting doctors educated on how to deal with patients who are from different ethnic backgrounds, but also inviting them to be able to say the things they need to say to be seen and heard is really important. What are your thoughts on how we manage this moving forward?
I think just knowing that we do have a right to choose our doctors. I think sometimes we assume that if we schedule the appointment and we meet with them, that this has to be our doctor. And you can literally interview your doctors. If you don't feel like it's a good fit, you can switch doctors. You can, specifically find Black doctors and call them and speak to them about their own, beliefs and values. Some may share and some may not. But you have every right to ask, to make sure that you're comfortable with this person that's going to be taking care of this very important part of your health.
Where I find the challenge is that people don't feel like doing the work of transitioning to another provider. It's like, okay, now I have to provide all this information again. I have to fill all of this paperwork out. I have to give them all my deets. Like, I've already done that 2 or 3 times, but it's part of the process, because you need to be properly cared for. You deserve to be properly cared for. But I think that work is so discouraging for us, because it's already like the hesitancy or the apprehension prior to getting there. And then we go and then we deal with these situations or challenges in the appointment. And we're like, forget it. I'm just not going to go to the doctor, especially when it comes to sensitivities like colorectal cancer or gut issues. We're just like, we'll drink the ginger ale and eat the crackers. And all the while, it's not normal to have a recurring stomach aches or stool that looks like a ribbon, or blood in your stool, or just chronic pain every single day or 3 days a week. That's not normal.
No.
It should trigger us to want to get help, right?
Yes, and ask all the questions and fill out all the paperwork and do all the stuff. I mean, even if you have to keep, a template of all the information and just bring that with you to every doctor's appointment.
But that's like the best way. If we're managing our healthcare, keeping a journal or keeping a sheet that just is like a one pager with, here's the tests that I've done, here's the date, let me just update it. And maybe that's something I need to create, because I have that for my nonprofit, but maybe I need to put that out there so that our community is better managing what it is that's going on with them, so that they don't feel like they're constantly duplicating work that makes them feel like exhausted.
Yes, or vulnerable and open, having to open up all these wounds that they had not thought about in so long.
Right. So as patients prepare, new patients, patients that haven't gone to the physician before, and ones that have had such a bad experience, what are some of the tips that we can actually give them to keep them focused and committed to seeing their care provider?
I think just acknowledging whenever you feel uncomfortable, or if you feel anxious going to a
Right.
doctor, anytime, your heart starts beating real fast whenever you get ready to go, or your hands start getting really sweaty, like noticing those things and
Right.
figuring out why you feel that way. Because
Right.
it can be, some things that we may have learned in the Black community about going to the doctor.
Right.
The whole, you keep everything at home, don't tell anybody anything narrative, and
Right.
figuring out what that is for you, understanding that, there may be some experiences in the past or traumas in
Right.
the past where you have visited doctors and it has not been a great experience. Whatever those things are that make you feel nervous and make you feel anxious about going, like, it's not something that's fake. It's not something that you're dreaming
Right.
up in your head. It's a very real feeling.
Right.
And so determining what that is and why you have those emotions around it.
I think it's important for us to have those real conversations with ourselves too,
Mhm.
because we don't always say that this is what I'm feeling or this is where this is coming from. So we don't do the investigative work to say, why is this that way? So,
Mhm.
Acknowledging apprehension and being honest with yourself about what you're feeling. Okay, that's good.
Mm-hmm. And also, talking to a therapist about it. I think people have the notion that, it has to be chaotic situations whenever you go to your therapist.
Right.
But you can
Right.
sit down with a therapist and say, look, I have doctor's appointments coming up and I feel
Mhm.
super nervous and anxious about it.
Right.
And I don't know what to do. You don't have to go into the therapist's office knowing what to talk about. That's
Right.
the therapist's job to kind of
Right.
guide you through that
Right.
conversation.
Right.
Just
You
come
do
and
your
say,
job and I'll do mine.
That's it. Just come and say, I'm nervous. I have doctor's appointments. I don't know what to do. And then you can stop. And the therapist will guide you along to try to figure out what those emotions are and to kind of help you figure it out. So talk to somebody about it. Bring somebody to the appointment with you. I think it's important for just all of us to realistically understand that it's a lot of information that we get from doctors. It's a lot of information that's kind of spewed at us. Some words we understand. Some of them we don't.
Right.
But just kind of knowing that, I may hear a lot, I may see a lot, and I need somebody to help me navigate all the information once I'm done. You can take notes with a doctor. You can say, wait, let me pull out my journal. Let me write it down so I can kind of do my own research later to make sure I understand what's being said to me. And also, whenever you're in the doctor's office and they are saying a lot of information, feel encouraged and empowered to ask what certain things mean.
Right.
Even if the doctor seems like they're rushing or trying to get out of the office, you can say, wait, calm down, because I don't understand. I need you to explain this to me. And it's completely okay for you to do that, because that's their job to make sure that you understand when you leave what's being said and what's being done. Because I've had clients where they'll come to me and let me know the diagnoses that they've had. But then when I ask them, what does that mean for you? Like, what kind of complications do you have? They'll say, I don't know. I don't know what all the symptoms are. I don't know what this means. I just know that this is what I was told. And that's just not okay. You have a right to know what's being done to you. You have a right to be able to understand it, explain it. So just ask those questions and bring somebody with you, take notes, all those things.
What I say is, if you don't understand, then you have not been diagnosed.
Right.
Because if you don't understand, you haven't been diagnosed, which means that you cannot properly ascertain what's going on. You can't say, well, here's what I'd like to do. What are my options? You're being exposed to an area that is uncomfortable, and you can't determine what's the best next steps for you if you don't understand. Understanding and comprehension is a huge part of navigating your health journey.
100%. And I tell people all the time, you are the expert of you. I can't tell you what you have or what you experience, and nobody else can.
No.
So unless you tell me, unless you can understand what's being done, then it's not a thing until it's a thing.
Absolutely. That's great. So we're going to say, acknowledge the apprehension.
Yes.
Once you've acknowledged it, determine what makes you feel that way.
Exactly.
Talk to someone about it. Bring someone with you to your appointments.
Yes.
Share the apprehension with your doctor. Ask questions. And if you don't understand, stop them and have them explain it to you in a way that you can digest it.
Exactly. I tell people all the time, I'll tell my doctors, look, talk to me as if I'm 5 and I do not understand anything you're saying.
Right.
And let me make sure that I understand. So talk to me as if I'm not this 35-year-old that's sitting in your chair. I'm 5 years old. Explain.
Absolutely. Because when they hear that, they bring it all the way down, because there's a way that you speak to a child to get them to understand, but also there's a level of compassion and understanding and nurturing that we have for children that we don't always have for the adult patient with a lower health literacy understanding and who's just not in this medical space and who has dealt with the structural racism impacts in healthcare.
Exactly.
So, thank you so much, Dominique. This has been great. We are going to put these up, and we are going to let everyone know how to reach you. We appreciate your partnership here at What the Gut.
Awesome. Thank you so much.
We hope that you've enjoyed our show today. Thank you so much for tuning in. Just remember that no matter what life throws your way, you've got the guts to get it done.